Today we're going to talk about mental health. Hi, my name is Dr. Choo Bok Ai and I'm a radiation oncologist. As part of my job, I see patients with cancer. Cancer is known to cause a high degree of stress and anxiety. Not uncommonly, patients and their caregivers can end up with clinical depression when they felt that they have lost control. While it's natural to feel sad when diagnosed with cancer, when the sadness is prolonged and not managed, this can often result in loss of hope that affects eating and sleeping with an overall loss of quality of life. Now with the added stress of COVID pandemic, it has added more complexity to the situation. Throughout the years, I've learned as a doctor that while giving patients the right treatment is the most important aspect of my job, looking at the holistic way to treat the patient is of paramount importance. Mental health is equally important as part of the treatment itself and is a disease in itself. In a recent study by the Institute of Mental Health in Singapore on the impact of COVID that was released in August 2021, it was found that about 13% of over 1,000 participants reported symptoms of anxiety or depression during the COVID-19 pandemic, with 81.8% of them saying they are willing to seek professional help. This anxiety and depression will also frequently cause sleep disturbances. Now, but what is more worrisome is that in this study, 4.9% of the respondents say they have experienced suicidal thoughts in the last 2 weeks before they were interviewed. The causes of this stress are mainly due to uncertainty of the future in terms of employment, financial loss, and also poor health. Mental health has now become a top cause of concern, but there are various strategies one can do to improve it. Firstly is to recognize that there's a problem and willing to seek help. Finding someone to talk about it usually helps. Next, recognize the potential triggers and find a solution to these triggers one by one. Some of the triggers may not be directly under your control, but changing your perspective on how you look at situation often helps. Try also to indulge in activities that give you pleasures that can reduce your stress. Commonly, this is the form of exercises or food or any pampering treats. Lastly, it's a good time to relook at your life purposes and knowing that there are people around you who cares and willing to help. There are now also multiple organizations, groups and professionals who can help too. In life, there will be good times and bad times. Even in stage 4 cancer, if there is no longer a cure, achieving a quality of life that is worth living and that brings pleasure is still achievable. Most important to not give up hope, because hope is the most important element of our daily living. Mental illness is more common than you think and you are not alone. It can be treated. I've designed a program called the Masterclass series to share my experience in helping my own patients to cope with stress. This can help to increase the knowledge of anyone who is keen to learn more. In the program, I'll speak on the various methods on recognizing the triggers and signs of mental illness as well as building resilience. I will interview and partner with other psychologists and cancer survivors to discuss topics of interest. Come and join our Masterclass in mental health to learn more about your health through facts and evidence-based medicine.